Okay, it is 9 o'clock. I'd like to call the Planning and Policy Committee to order as of Tuesday, October 14th. First on the agenda is public comment. Any public comment at this time? Comment online? Seeing none, move on to the approval of the agenda. Is there a motion to the approval of the agenda?
So moved.
Support? Motion made. All in favor, say aye.
Aye.
Aye. Opposed, the same. Carried. Consent resolutions, approval of the minutes of September 9, 2025. Is there a motion to approve this consent resolution? So moved.
Support.
All in favor, signify by saying aye.
Aye.
The same. Move on to action items. And the first action item is the Land Bank Authority bylaws. And the motion is to approve and forward to the Board of Commissioners the updated Ottawa County Land Bank Authority bylaws.
So moved.
Support. Motion made and supported. Cheryl. Good morning.
So last month, there were some items in the bylaws that wanted to be, you guys wanted to be changed or asked to be changed, so I did that. I also found some other things that needed to be changed at the same time. So I presented both the red and, so the red line copy is the original changes I made. The blue line are the changes I made after your meeting last month. The changes include in section 3.2, where we added what we would like the members being representing the townships, cities, villages. We expanded that to include an employee who is involved in economic development. And also we changed the representative because we no longer have the Ottawa County Economic Development Office. We changed that to the Ottawa County's Economic Development Organization, which at this time is, can't think of the name. Yes, thank you. So that was the one thing we changed there. 3.3, as you can see, we changed, we included the terms and the wording about how they have 6 years, an elected official or employee appointed under this, maintain that status, and a vacancy. We included all of that in there because we did run into that a couple of times since I've been here. So we just basically made that sound like the intergovernmental agreement that we have with the State Land Bank Authority. And you'll see I also found where there were he, she's, or he's, and I added she, or change it to he or she. Let's see, the 3.5 was the section about the vacancies and being filled by the Board of Commissioners. I was just trying to change it to what is actually being done, and what is actually being done is that I am reviewing the applicants before, just to make sure that they meet the qualifications. And then I forward it on to, I think Regina sees it, and then somebody forwards it on to you guys eventually. So I wanted to make sure that I had that clear. So I did change the wording in there, that before your appointment, I do review them. Let's see, and then 4.1, those were the shalls that I changed to shoulds. Now we're back to shalls. And I noticed that in Article 5, it said notice and or waiver. Somehow I changed it to and. I don't know why, but I changed it to or. It should be and, so I changed that back. And then, let's see, 9.2 is about the checks. It had said, let's see if I can find it here. Drafts, it had drafts and notes in there. We don't use that wording anymore, so I just updated that to wording that we do currently use. And that I clarified that it is signed by the chairperson of the corporation, which is the chairperson of the Land Bank Authority, me, because I do sign the checks, but they are approved by the treasurer, which is the appointee of the administration. And then, let's see, 10.4, the audit. I changed that information because we no longer have anybody on the Land Bank Authority that does the audit. We are now hiring the audit firm that the county uses to do the audits on the Land Bank Authority. And I started doing that because we had more money flowing in and out of the Land Bank's fund due to the blight elimination grants that we had received from the state. And so I wanted professional eyes to look at it and make sure that everything was done properly. So we are now hiring and paying for the audit to be done. Do you have any other questions?
I just have one. I wanted to just first say thank you, Cheryl. I really appreciated how it was presented here. It made a lot of sense, and you can tell a lot of effort has been put into it. One very simple suggestion I would make to the board would be on page 11 in the packet under 3.5, where a lot of the changes were made. I would suggest where it has in blue, underneath that paragraph, it says prior to making such appointment, the chair of the board of directors, it currently reads, shall review the applicants. I would suggest and make a motion, shall review and forward all applicants.
Okay.
And then continue and certify to the board of commissioners which applicants meet the required qualifications. That way it's just showing that we are receiving everyone that applied, but then it's also showing us who you stated meets the required qualifications.
Okay. So shall review and forward?
Yes. All applicants or applications.
So are you making that a motion?
Yeah, I would make a motion to change the wording till the chair of the board of directors shall review and forward all applications. And then the rest stays the same.
I can second that.
Any other discussion on it?
Just a quick question, then would that be denoted or not denoted? Like,
I think the certifying to the board which applicants meet the required qualifications still in there, so
but I mean, how would we know?
how would you know?
Because
what?
she's going to,
It says which applicants.
Right, how would we actually know which? I mean, are we gonna do the star thing again, or?
So when I review them, I'm not sure what comes over to you, but when I review them, I mark that they meet the qualifications. It's all part of the system online, part of web text. And then I make notes in there on how they meet those qualifications, or if they don't meet the qualifications, I put notes in there that say they don't. I don't know if that information gets forwarded on to.
That's my question, is like, how would we actually know that?
Yeah, I don't know.
I mean, it's cool what you're saying, and I agree with that, but it's like, how is that information actually gonna get to us, right?
typically when we sit on the alignment and appointment committee, we receive all applications and
Right.
we receive information that says whether or not they qualify.
So would that be done in the interview process, is that what you're saying, or is that be done in the actual committee process on voting?
I think that it would be incumbent on the chair of the board of directors to certify that information to the board. So they could put it in a data table or attach it to the application.
Yeah, I get that. I just want to say, how is that going to be presented? Is that going to be presented only in the interview process, or would that be also as part of?
You're wondering if it's going to follow through in the packet, like
Right.
later on, and it's going to show that these people applied, but now they're not eligible.
Right.
I understand what you're saying.
I
And what were your
understand.
thinking on that? Sorry.
Well, I understand what you're saying. I feel like the language shall review and forward all applicants and certify to the Board of Commissioners which applicants meet the required qualifications. Whether she puts a star by it or writes
a
a
different-
synopsis,
I can
doesn't
find,
matter to
we
me.
can look into that some more and figure out how that information that I enter in there, how that gets back to you. Make
And-
sure that you see that. If it doesn't get forwarded on to you, then I can make sure that I let you know, like send you a memo or something before you vote on it, if that works.
Right, I just want to make sure that if we're doing what you're saying, Commissioner Medem, I agree with that, but it's like, how is it actually going to appear, right?
I think that that is a different discussion apart
Okay.
from this motion.
Okay.
I think Regina might have some information.
Some feedback.
Yes.
All right, so I can tell you that this will be noted when the Appointment and Alignment Committee have their interviews. The ones that do not meet the minimum seat requirements, which is what Cheryl is going to be identifying for us, you will have those in a separate packet. I don't suspect those will go forward, but that will be up to Appointment and Alignment. But that you'll have a note on those, which ones do not
So
Mm,
meet the
we
minimum.
would
seat
still
requirements.
interview folks who don't meet the required.
You will receive their information. I won't schedule interviews for those individuals unless asked to do so.
Okay.
So-
And then in the voting process, they will still appear in the packet, but separate. I just want to make sure that we're kind of completing the thought here.
I guess that would be up to you. At this point, I do not believe we've been including them in the packet just because they don't meet the minimum seat requirements.
Sure.
It's fairly rare. I mean, we have a couple of seats that are obviously a little bit more niche, a little bit more specialty seats, but for the most part, it's basically general public.
To Commissioner Zylestra's point, this is something not just contingent on the Land Bank Authority bylaw,
Correct.
so I don't want Cheryl to feel like this
Yeah.
is on Cheryl. It is something I think that we need to have a further conversation with at the Alignment and Appointment Committee. And because it is something that has come up and it has gone both ways. In the last 2 years, they have all been included in the packet and it has said not eligible. And you're sharing that maybe that has happened a different way before.
Sure.
So I think that is something that we will need to have further discussion
great.
on.
Thank you.
Any other questions or comments?
No.
All in favor of Allison's motion to agenda it, signify by saying aye.
Aye.
Opposed, the same. Motion carried. Now to vote on the Land Bank Authority bylaws. All in favor, say by saying aye.
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 Opposed, the same. Motion carried. Thank you.
Thank you.
Thank you, Cheryl. Move on to item 2, the item is Explorers Trail, the Jones easement. The motion is to approve and forward to the Board of Commissioners a Jones easement agreement for Allendale segment of the Idaho Explorers Trail.
So moved.
Support.
Motion made and supported. Jason.
Good morning. Thank you.
Morning.
So you have before you the first of 3 easements for the Allendale segment of the Idaho Explorers Trail. These 3 easements are, I think, part of a total of 7 that we have Land Matters, a consultant working with us, working with homeowners to acquire easements necessary for the Allendale segment. So these are all 3 south of M45 on the east side of 60th Street. So we're working on final design and plans. We're anticipating a transportation alternative grant application later this fall. Allendale Township has supported this project both financially as well as worked with us on the route. We had a public hearing or a public meeting in September there, invited all adjacent property owners to attend, and we got public feedback. So happy to answer any questions.
Questions?
Not particular about this, Jason, but I think in general, when these come forward, and maybe it's the builder in me who likes to see site plans and so forth, and I don't need to see a site plan, but a visual that says, here's where the easement is kind of cool to look at and gives me better
Okay.
understanding of where they are. Not going to hold this up at all, but maybe on the next ones, it'd just be nice to have that.
Yep.
So, that's all. Otherwise, great work.
Thank you.
Anything else? Do a roll call on this, Rachel? Yeah, roll call, please.
Mr. Moss,
Yes.
Mr. Barry,
Yes.
Mr. Bonema,
Yes.
Mrs. Rhodey,
Yes.
Mr. Zylstra.
Yes.
Mrs. Wenzel,
Yes.
Mrs. Medema,
Yes.
Mr. Juritzma,
Yes.
Mr. Bruger,
Yes.
Mr. Kyers.
Yes.
Motion passes.
Thank you. Number 3, the suggested motion is to approve and forward to the Board of Commissioners the Rapine Kavinsky easement agreement for the Allendale segment of the Idaho Explorers Trail.
So moved.
Support.
Did I get that last name right? Pretty close. Any discussion? Please call the roll.
Mr. Barry,
Yes.
Mr. Bruger,
Yes.
Mr. Zylstra.
Yes.
Mr. Bonema,
Yes.
Mrs. Wenzel,
Yes.
Mrs. Medema,
Yes.
Mr. Moss,
Yes.
Mr. Jurisma,
Yes.
Mrs. Rhodey,
Yes.
Mr. Kyers,
Yes.
motion passes.
And number 4, the motion is to approve and forward to the Board of Commissioners the Quaker easement agreement for the Allendale segment of the Idamas Explorers Trail.
So moved.
Support.
Motion made and supported. Any questions? Please call the roll.
Mr. Bonema,
Yes.
Mr. Jurisma,
Yes.
Mr. Bruger,
Yes.
Mrs. Medema,
Yes.
Mrs. Wenzel,
Yes.
Mr. Barry,
Yes.
Mrs. Rhodey,
Yes.
Mr. Moss,
Yes.
Mr. Zylstra,
Yes.
Mr. Kyers,
Yes.
motion passes.
Thank you. Move on to Health and Human Services updates, and the first one is Public Health from Adeline Hambley.
Hey, good
Adeline,
morning. So I have a few things for you. First, October is Infant Safe Sleep Month, excuse me. We're hoping to raise awareness for preventing sleep-related infant deaths. So in Michigan, 1,904 Michigan infants died due to sleep-related causes from 2010 to 2022. In Ottawa County, unfortunately, we've had 30 deaths from 2010 to 2024. Part of the campaign is to raise awareness around the Academy of Pediatrics guidelines that they call their ABCs, which is alone on the back and in a crib. Part of that, of the infants that died, 50% were in an adult bed. 70% had objects in the sleep environment like blankets and pillows. So part of what we're doing in October as public health, there'll be some social media information shared. There's also a fifth annual home visitor training in November. That will be public health, CMH, DHS, OAISD, and early Head Start home visitors. And part of this year's training will really focus on infant safe sleep and strategies that we can use to support families. Our home visiting team will continue to provide education to families and referrals for safe sleep resources for those families that might need some help. There's also an infant safe sleep virtual 5K Your Way that you can participate in. You can walk, you can run, you can ride your bike and log your time. And they're just asking for some activity for 30 minutes during the month of October. I can send a link if there's any walkers that would like to kind of have their walking tracked on that. Let's see, some other updates. I think I sent an email to everyone for the HPAI positive farm, commercial farm in Ottawa County. We don't have a whole lot to do with that. MDARD oversees that. We do the human health monitoring. And so my update today is there are no human health reports of illness. We do, however, have a human case of West Nile virus. The case is hospitalized. We do mosquito collection. I think I've kind of talked about that before. We have had West Nile positive mosquitoes in some of our mosquito pools here in Ottawa County in the past. We've had 4 confirmed human West Nile virus cases in the past 5 years. And so it's just a reminder that is in the environment. It can cause some pretty serious illness for some people. And so especially if you're out at dusk, especially with football season and things like that, with dusk happening earlier, to wear repellent. There's still mosquitoes with the warm weather that we're having. With respiratory season starting, best protection is vaccination. Discuss with your healthcare provider. However, a really, really great precaution is to stay home if you're sick. Keep your kids home if they're sick. We recommend 24 hours fever-free before you're kind of back around people. Of course, as always, with anything public health, wash your hands. And one thing that will start now with respiratory season is we will begin posting our respiratory virus trends weekly on our website, so you can see kind of what's kind of happening in the community for cases of illness. And then last, we have started our strategic planning in public health. And as part of that process, we seek stakeholder engagement, of which, of course, you are one. So you will likely be receiving an invite or a survey to complete so that you can share your thoughts and input into that process. I would expect that probably sometime in November, end of October here. So that's it. That's what I have. no other huge gross illnesses, so.
When was that walk again?
It's all month because it's virtual.
Okay,
Yep, so you can just log, if you're a regular walker, you can just sign up and log your time.
thank you.
I'll share the link through email.
Okay, thanks.
Perfect.
Yeah, I would just like to share a little bit more information on SIDS, and you may or may not agree with me on this, but I personally had an experience where my son went into respiratory distress in my arms, not sleeping in a bed, and then was placed in the NICU. And this was, within an hour of receiving the Hep B vaccine. And so there have been a number of studies that have found that SIDS correlates pretty strongly with vaccination. And so I want to point that out because if parents are being watchful of their babies, it's really important that they're watching within 24 hours, the next 3 days, the next 7 days, even a month after receiving vaccinations. I think more of this is going to be coming out from the federal HHS, but it's just really important to keep your eye on infants following vaccination. And I think that this was really highlighted during COVID when babies were no longer going in for their well child visits. The rates of SIDS pretty much went down to about nothing. And so that really backed up what a lot of parents had been experiencing in regards to the SIDS deaths and incidents like my son had, where they went into, pretty significant respiratory distress. So anyways, I just want to put that out there, that if we're talking about SIDS, I think it's really important that parents also watch in the month following vaccines.
Yeah, I would say, given some of the statistics, that the environment for sleep is really, really important to keep an eye on too. The majority of the deaths that are reported have that's either like in a bed with a parent or in a crib with items, or having the infant fall asleep on a couch or a chair. So really, really being aware of the safe environment for sleeping is very important.
Addie, thank you.
Mhm.
Important information, great reminders. I've raised 5 kids, but it's been a long time since I've had infants back in the house, and we have 2 now. So these are really good reminders for grandma and grandpas too. So appreciate that. We've talked about this over the years, the implementation of online vaccine education in an effort to decide on whether or not you want to do a waiver. I don't know if there's any updates on that, bringing that to Ottawa County.
We just had a meeting. So when we had talked before, some of the counties were rolling out their own. And that's kind of the path we were going to take. However, then the state worked with U of M to make the online module, because what they were concerned with happening is the few counties that decide to do that being inundated for their capacity for being able to process those. We just had a meeting last week from the state with an update on that, and that I would anticipate that's going to be ready to roll out here in the next month or so. And then once it does, I can keep you informed and share the information and the link. And how it would work is it still requires a signature at the health department, but you do all of the education module at home on your own, and then you come in and have that form signed. But I would anticipate definitely before the end of the year. So, yeah.
Thank you.
Thanks, Jacob, for that info. Yeah. Anything else? Well, thank you very much, Andy.
You're welcome.
Next, we have communal mental health. Michael Bashers. Michael, good morning.
How are we doing? Is there a plug for this so I can project it? Okay, no worries. Plan B. Okay, this morning you got an email from me with an attachment I'm going to show you and go through some of our vital statistics. I'm going to cover about 4 areas today. It's been a while since I've been before you. I was asked to kind of move 1 month and we kind of missed one. And I was like, oh yeah, I do. I'm supposed to do this like every other month or something. So you might have me 2 months in a row. Looking forward to it. But I always like to come and update. what's going on at CMH. Yeah, there's an awful lot. Some vital statistics I always like to share with you are outcomes that I emailed this morning. And these are for the months of, excuse me, July and August. And I like to show you first like crisis contacts. Then I like to show you kind of utilization. And then I like to go over some of the trending on that. So for those months, we had 219 crisis contacts, and that means it's people that contacted us because we are the public safety net for anybody with Medicaid, no assurance, or anybody in the public, regardless of an ability to pay. We get, our crisis department gets contacted. So in those, we had 219, and of those, 71% did not result in an inpatient hospitalization stay, which is a good number for us. And 29% did result in an inpatient stay. I get a little bit, when we look at some of the training data, if it's over 25%, I then do a deep dive of every single person that was hospitalized to see if indeed I would agree, and our medical director and others would agree with the hospitalization. Every crisis contact is a potential psychiatric hospitalization. And you should know the average length of stay is 3 to 10 days, sometimes longer, and an average cost of $1,200 a day. So we want to make sure we're providing services that don't disrupt the lives of individuals, especially in crisis. And we don't like to see people go into local hospitals, but it is a legitimate level of care. And I want to make sure the utilization rates are correct on that. And in your packet, you can get a sense of the types of crisis alternatives we use besides hospitalization. Crisis residential is one of them. And if you remember, a couple of months ago, we made a change in our Robert Brown Center, which was a crisis residential program. So I've been watching inpatient utilization rates to say, is there an impact with us, with Hope Network, closing that option to divert hospitalizations or not? And the answer is we had a slight increase of hospitalizations, and I wanted to make sure that they would not have gone to the crisis residential program. So I did an examination of every admission for the hospitalization and agreed that none of them were suitable for a crisis residential diversion. That's important because I told this commission and the CMH board that we had other options for crisis residential, and the impact of closing Robert Brown, I would keep an eye on, and I'm keeping my word on that. You should know, way of information, we're in the process of retasking Robert Brown to become a specialized residential center for folks with developmental and intellectual disabilities with the most severe forms of behavioral disruption. And so we're going to gain a resource, but I had to make sure, and I will keep a close eye on that because the community legitimate was concerned that we lost a resource. We've been able to retask that, use other crisis residential programs, but I am keeping an eye on inpatient utilization and would they've gone to Robert Brown if it was still open. So it's monthly, and I report it, and it's reflected in some of the annual rates. And some of this, you'll see a slight increase. And I went, oh boy, I better figure out if that was an impact or not, and it was not. So the other information I'd like to share with you, and kind of our vital statistics, is basically our eligibility determination. You know, when I first got here over a year now, a year and a couple of months, 3 months now, the concern was no one gets into CMH. There was lots of concern about access. And the feedback was, boy, it's like a brick wall to get in. And so I started immediately reporting on our access utilization data. What do I mean? The percentage of people that come for an assessment that actually get in and start services. So for that 2-month period, we had 131 eligibility assessments, and 91% of all the people that were assessed were found eligible for services and started services within 14 days. That left 9% that didn't. And of those 9%, a referral source was found for every single individual. If we couldn't serve them based on our criteria, we found a place that could help. And that's through our Navigator program. And I am monitoring that closely, and I've been doing it by population: autism, family services, IDD adults, MI adults, SUD programming. And so in the packet, in your email, you'll see I have that broken down. Usually autism was like almost 100%. The last couple months, it went down to 88% in terms of somebody presented with an autism diagnosis that met our criteria, and the percentages we didn't find eligible. And the drop in that percentage is due to the number of cases decreasing, and a couple of folks that it was clear that the private health plan should provide the service. But I do have that broken down. Usually, like if you look at the packet, you'll see, gee, IDD adults was at 43%. Well, there was only 4 people that were asking to come in and 3 of them got in. So the statistics got messed up when you look at some of that. And so sometimes the low numbers can skew it. But overall, we had a pretty high admission rate of people seeking assessments and getting into services. Now, what I'm doing next is looking at who came in and were screened, didn't even make it to the assessment phase. Because there is a group of people that will do a screening. They might call us for one reason or another, like you're not even eligible for an assessment. I now want to know what happened to all the screening people. So I'm starting to look at the number of people that contacted us, went through a screening that didn't make it to the assessment piece and why. And you should get that in my next report. Because it's easy for me to say, gee, 91% of the people that were assessed got in, but if like 80% were screened out, right? So I'm looking into that dynamic to ensure that community access is maintained. So what you'll see is kind of like trending in one of the reports over the last year related to that. And our historical trends are staying about equal. With that, we did have an increase in inpatient hospitalization in May, and that was right before we closed Robert Brown. And it went up to 40% of the people in May that were in crisis ended up in the hospital. That's a high percentage. The overall numbers were lower. We did an internal audit to double check our utilization management criteria to, yes, agree that they met inpatient criteria. And were they already getting services from us, and did we miss anything? So once I get this data, it actually introduces a set of questions that I do further follow-up on, because data is only as good as the evaluation that happens after the fact. If not, you're just reporting numbers, and so what? So it gives me information to dig down deeper of when you see an increase, especially two months in a row. To me, that requires a quality improvement plan. If I see it trending up for 2 consecutive months, I'm putting in place a quality improvement plan to examine those data points. So before I move to over some other topics, any question on some of the utilization and crisis data that I have presented?
One quick question,
Mhm.
just very general. I'm curious as to what system you're using to retain all this data and to manage it.
Power BI
Great.
through Microsoft products.
Great.
And our new EMR that we put in, we call it Auto. The county was going to use Auto for something else. We stole the name. Auto was our electronic medical record that we put in place within the last several months in June. And that is giving us some data analysis capability from our records that we didn't have before. So a combination of our EMR and Power BI.
Great.
Okay. Some events. So the 10th of October was National Mental Health Awareness Day. I was on the 9th Talk of the Town, the radio show in Holland. You can hear the recording. It's posted on the website, talking about mental health awareness, how every day is Mental Health Day in Ottawa County. We like to celebrate single days for nationwide, but sometimes that leads to just, oh, today we're going to pay attention to it. And to me, usually CMH services get paid attention to when there's an adverse situation in the news. So we're doing a lot of aggressive education. We have the Did You Know series, which I do once or twice a month. I just completed one, and I started a new series called CMH Vital Partners. And the first one was with our Clubhouse program in Holland. And they did an event on Mental Health Awareness Day as well that our staff participated in. If you're interested in learning more about the Clubhouse, there is a recording All of my materials for those are posted, they're linked, and you can watch them at your leisure. And what usually happens the day we do the recording, I'll get 5 or 6 people or 7 people join, and then after the fact, like 100 people will go on and look at it after the fact. Shout out to Stephen Rockman that used to be on our board. He attends every single one, along with other folks that we have and other key community members. But I appreciate the participation from the community in that. And again, we get more feedback after the fact than during the live stream because I do it on Fridays at noon. So a lot of people kind of doing things at that time, but that is an educational piece for the county commission. So the next topic I'm going to talk about is giving you an update on the state of Michigan's plan to bid out, or what I would call privatize, the public mental health system in terms of manages it. I don't know if you could hand this out. There's some color copies and black and white copies of this. Now, I have reported on this before, and I've also done extensive community meetings related to this that have been recorded. I did one on September 5th, August 15th, and June 20th. If you go to the CMH website, you can watch those recording, and every attachment that I review is there, including the actual plan from the state, the application for participation, lawsuits that have been filed, which I'm going to talk about it, what it means to us. I've done to the point where we're now waiting to see what's going to happen based on a key development that happened last week. So if you're wanting more information about the procurement, you can always call me, the contracting out of who manages our system. But to the public and the commissioners, there is extensive, and I talk a lot, so you can fast through forward some of it, the entire plan, the impact of the community, and questions and answers to that. And there are 3 different sets of materials that can review at your leisure. And I found that that's a good way to do it because I could talk about it all the time. What's happened recently is the CMH system, meaning the CMHs across the state, and to remind everybody, there are 46 CMHs across the state serving all, is it 80, how many counties we got? 83 or 80, 83 counties. Some CMHs serve more than one county. Most CMHs serve one county. And of the 40, we belong to a trade association called the Community Mental Health, CHAM as we call them, and they get us together and we kind of work together. And so what had happened is once the state put the plan to contract out the system, meaning who's managing the system, the Lakeshore Regional Entity, not CMH, but who's managing it, we're partners with, a series of lawsuits were filed. And I have information on the lawsuits that I will email to you. And it just tells you kind of like the nature of them. But in essence, what the CMH is, what we have said, and we have provided feedback, but we are not a plaintiff or whatever, or a subject in the lawsuit, and we have not in Ottawa County donated any legal funds for said lawsuit. This was filed on behalf of a couple of the CMHs. And in essence, we were saying that the state does not have the authority to privatize who manages the system for various reasons. I'm going to go through some of them in a moment. So what happened was we all, and the lawyers will know what I'm talking about, we filed an injunction to stop the state from moving forward with the contracting out or privatization of these regions. There was a hearing that was last Thursday. I watched the whole thing live, and the judge basically said, listen, I'm not going to grant an immediate injunction to stop, but by Tuesday today, he's going to have a declarative judgment, he says, and he just said it in open court, and you can watch it, that will force the state to allow the public system a chance to address any of the concerns they have before he will allow procurement or contracting out to move forward. What that means, I don't know, but when I get the information today, I will send it out to the world, don't you know it, with my objective opinion on what I think it means, not a subjective opinion, like pros and cons to what we think. My hope is that the system has a huge pause. No doubt reform is needed in the public mental health system, but you don't have to destroy the structure to do it. We can accomplish all of the stated goals the state have at improving the system without radically changing how the system is managed. And I have been in a group that's provided feedback for months to the state and will carry on to do that. We need more choice for clients. We need consistent rates across the state. We need equitable funding for every CMH across the state. We need all of those things. And we can do that without destroying the system. In fact, I will let the commission know that the state of Michigan has no obligation to have this PHP level at all. In fact, from 1962 to 1999, that's how it was. Ottawa County had the Medicaid contract and the general fund contract. We managed it as a county department across the state. Once we moved to these middleman regions in 2000, for legitimate reasons, too much to go into, it fundamentally changed the relationship between how Medicaid benefits run, general fund, and our role as a CMH. We're part of regions. I say, if you don't keep the current region, go down to zero. And I even play that song Saved by Zero in the 80s to remind myself. We actually don't need a single PHP entity above us. We can, if the state wanted to, return the PHP functions back to the CMHs, have 46 contracts and have the state manage it. You want to get rid of administrative layer, then by golly, do it. Get rid of it all. The state's plan is to go from 10 regions to 3 super regions. And there are a lot of myths and facts about that. I've handed you a myth and fact sheet that's been developed by our board association, CMHA, that I was a part of, putting the feedback in. So it's my viewpoint with this. So you can read through these, but I'll read through a couple of them. The proposal to bid out the system. The myth is the proposal eliminates an administrative layer and related costs and does not cut funding for services. Fact, it's our estimation by reducing from 10 to 3 in the way they want to do it, will actually increase administrative costs by $500 million. And if any commissioner wants backup to how we get to that number, happy to send it to you. It's our belief by going from 10 to 3, doesn't make sense logically, I know, that you'll actually increase the administrative costs for various reasons. Right now, the current PHP system has an administrative cost that's far less than the health plans. And if this stuff is given to the health plans, they are allowed administrative costs, sometimes up to 22%. So that's basically the genesis if we get that. The proposal keeps the CMH system intact. That has been said over and over again by Director Hortel, Michigan Department of Health and Human Services, and other places. In fact, it does not. It does not allow a CMH to co-manage the Medicaid benefit like we do now for our county. We will be a service provider only and not responsible for any contracts with any subcontracting relationship we have. We won't be allowed. So we'll go from CMH with all the contracts that we help to manage the system to like a Hope network, where what we do is just provide the service. I will not be required to provide all the services or ensure that the citizens of Ottawa County are getting all the services. This huge region will do that. The region would have 33 CMHs in it and 44 counties that would be a part of. At least the residents of Ottawa County can yell at me. I don't know where you go when you have a complaint about Medicaid services in a region that's the side of Rhode Island, literally the side of Rhode Island. So this plan fails to accomplish the stated goals and it has an existential threat and how CMH functions within Ottawa County. There was appropriate feedback. I think it was either at a CMH board meeting or was at this meeting that, hey, we need to revise our residential system. We need to have a level of care system that's clearly defined with cost. I just completed that task and rolled it out with the CMH board in the public last month, right? I will not be in that business if we're not a co-manager of Medicare care. I'll have no responsibility for any service that I don't choose to directly operate. You can tell I'm pretty jazzed up about it. It's a threat that has to stop. But I also want to say to the, and you can read the rest of the facts and myths, to the county commission and to the citizens, every concern that's been brought to the attention of the system can be addressed within the current system. We just have to have the courage to do it. So there's not like there isn't problems to solve. That's for sure there are. But this way is like a nuclear, it blows up the system. Now, finally, I'm almost at my allotted, Bashirs, you talk too much time. Finally, changes at the federal level does impact mental health system at the local level. Simply, if you change who's eligible for Medicaid, we'll have less people on Medicaid and less funding for CMH across the state. That is the simplistic way of understanding this, knowing that the devil's in the details. But without a federal budget, it's all moot. So I hope they do their job and pass a budget soon so that we can look at the impact to our county. Within our region, we have 36 days, just so you know, if the state didn't pass a budget, we had 36 days of operating budget for Medicaid in the region. I'm glad in the state we didn't have to utilize that because people got together and passed a budget. I think it's passed, right? Okay, as of today. Jordan, is it passed? Okay, good. Right. But I will tell you, is there a link between the PHP restructuring and the federal government? No. CMS, Centers of Medicare and Medicaid Services, has not told the state of Michigan in writing or any way that we're aware of to change the system. In fact, it's the stupidest thing to do in the world right now, while the federal government is trying to figure out things, is to change fundamentally how we're delivering or managing the Medicaid. But I want to be clear because there's misinformation out there. The federal government has not told us to change our model because they think there's a conflict of interest. I know that to be true, and by one simple other point of evidence, they've allowed the model for 25 years. So if there is an issue with the Michigan model in terms of a conflict of interest of CMHs and regions managing it together, CMS has allowed this, because they have to ultimately approve the structures we have, for a quarter century. So clearly it's not illegal or a huge conflict in what we're doing. I'll take any questions on that huge amount of information, which I apologize all at once. I haven't seen it for a while, so.
Yeah, Dr. Bashir, thank you for the presentation. Just wondering on this handout, are we going to see an action item on this, or is this for information only?
For now, it's information only.
Okay.
The way I've been doing is before I have county commissioners do a resolution on this and that, I want to know what we're actually fighting about. Like I have it in concept here, Commissioner, right? But I'll know after this lawsuit how it's going to move forward, like this injunction. And if there's a declarative judgment that still puts us at risk, then I'll be asking the CMH board, the county administrator to consider, and us to consider certain resolutions to state our position on it. I know the Michigan Association of Counties has. They are opposed to the restructuring plan.
Great, I appreciate that. Thank
Yeah.
you.
Other questions?
Yeah, I wanted to bring that up as well. So this was a lot of information, thanks.
Sorry. Yeah.
It's also an extremely important topic. So not being completely down into the details, I still appreciate the level of detail that you did bring here today. This was a big topic at the MAC conference that some of us just attended. The myths and facts sheet, I think we either received the same one or one that was very similar.
It's exactly the same one.
Okay, yeah. And they were very clear about their position that they are against going this direction. And didn't we have the MDHHS director come and speak to us?
You did.
Yeah.
Yes, he was the associate director, Alan
Okay.
Bolter.
You had Alan Bolter, who came to our CMH and did a Did You Know last month.
Okay.
So you can watch him saying virtually the same stuff to our audience only.
Yep.
He was presenting at MAC.
Okay. Well, it went really well. And I guess I'd highlight one thing. During one of the sessions, I asked the question, as they're going through all this information, who benefits? Who truly benefits from a such a massive change like this, or could be so disruptive or whatever? And the answer that I received back was insurance companies benefit.
Yeah, I'll say something to that real quick. Our failure in the system to address legitimate concerns keeps bringing this stuff up. So who I want to benefit are the clients. And this won't benefit them, but I understand why approaches to change the system are there. Because as a system, we have failed to acknowledge a couple of things. And we've gotten a little too comfortable over the last quarter century with certain things. So insurance companies are not even liking the plan anymore. They're starting to look what's in it and go, we'd have to, are you going to fund it appropriately? Which they have not done, especially last year, right? So I'm not sure, but I want to validate there are real issues that have to be solved that people have brought up. A lot of our own citizens.
Yep. Commissioner Ross kind of shared some of the thoughts that I had as well. For anyone who wasn't able to attend this particular workshop at MAC, it is available in the email that we were sent last week, and it's titled Community Mental Health System Redesign by Alan Bolter. And again, I thought as Dr. Bashirs this morning shared with us, I feel like Alan Bolter and you are very much, you're on the same page. I thought it was probably the best workshop that I attended while I was at MAC, and made it very understandable for those of us not in that world. And this particular sheet is also available on there in case anyone wanted to share it out electronically. So just another sidebar, I just wanted to share, I did listen to your talk of the town. I really enjoyed, what I appreciated about it was, I believe you had someone different there than Gary Stevens that
Yeah.
day. And it felt like the individual that you were speaking with, and I cannot remember his name, but it felt like you were just sitting in a relaxed, cozy atmosphere, having a cup of coffee together. And
Right.
to me, it really signified that that's how we should be addressing CMH, and it should be looked at as anything else, physical health issues.
That's right.
I appreciated how that time period was handled, especially as we were looking at the mental health, forgetting what it's called now.
Mhm. World Mental Health Day.
Yes, thank you. So I just wanted to say thank you and for how you presented. And I think the gentleman that came on with you shared even some of his own personal story, and he was able to dialogue with you in a very meaningful way. So I think,
Yeah.
I'm guessing that was pretty meaningful to the
Yeah,
general
I didn't
public.
know he was substituting for Gary that day, so I walk in,
Yeah.
I'm like, come to find out, I grew up in Newton, Massachusetts. He had lived in Newton Corner, right outside of Boston for years, and we realized we're in the same space at the same time.
Yeah,
And so it was a good opportunity. I love Talk the Town. This county in Holland's very generous. They give us airtime, they get the message out. It's not the same in every community.
nope. So thanks for going on.
Other comments?
There's
Questions?
one more. Yep. So when we were at MAC, I was able to ask Elizabeth Hertel a couple of questions. And one thing that was interesting to me was because I had the opportunity to ask her about CMH, a number of people from different counties then came up and talked to me about it. So what really struck me about it was it just really seems like CMH, people involved in CMH statewide are very unified
Mhm.
in their thoughts and concerns about this. Is that what you're finding as well?
Yeah, I am. We're having a united front. The board members and county commissioners are very united. Where some of the differences happen in our kind of group is some of the CEOs might think, oh, might this be better? Might this be different? But by and large, we're all united, but definitely at the board member level, county commissioner level, and client level that we've got an endpoint, it's a uniform message. Yeah.
And pretty much you're finding it regardless of party lines and.
Yeah, doesn't matter. Yeah, party lines, it doesn't even exist in this issue.
Okay.
Commissioner Bruger? Oh, I'm sorry. Go.
You have a specific, or mine's more of a general?
Yeah, mine was
Go
real
for it.
specific.
Yeah.
Is it possible that all of what's happening here might actually lead long-term to being able to dedicate funding closer to the local level instead of pulling it up into like these regional groups?
If the plan goes as planned and the state's allowed to do what the department, not the state, the Michigan Department of Health and Human Services, it will do the opposite effect. It will pool the money in a more centralized way. And there'll be no real local consideration of how Medicaid, you go from, right now we have this thing called county of financial responsibility. So if an Ottawa County resident goes to another county and they're not planning to live there, say they're getting services, we pay for that. And this new thing, that all dissolves, all the rates become flat, and there, you lose local management of the system completely.
Wouldn't they, in general, want to increase local management, just as a principle? Like we
If
see
you're
that.
using logic.
Okay.
Now, listen, there are problems
Makes
with
sense.
total local control too, in terms of uniformity. One of the biggest complaints you ask clients, I moved to the other side of the state permanently and they get so much more Medicaid for the CMH, they get more services. That's a problem. Funding equity now, uniform benefit has to be, if you're a legislator, you hear this all the time. How come if I live over here, I can get A and over here B? Well, because sometimes local control, if there isn't standards that unify us, can have an opposite effect. We're dealing with the resources that we're given. But you want more local control with a level playing field is the way to do it. So it's kind of like, the opposite view is like going to a forest and chopping all the trees down to the same length and saying, see, problem solved. But guess what? All the trees are now 2 feet tall and there's no variance based on local need. And that's what I think is happening. But I feel for legislators because they're like, how do you handle the issues on this?
And what authority can they push forward as legislators if this administrative appointment?
Well, eventually someone's going to have to approve a budget.
Oh,
All I'm saying is, boilerplate language is a funny thing. So someday, no matter what, someone's going to have to say, last year, the legislature actually funded us at a level that if we would have pushed it all out the right way, there would have been no deficits in the system. We had to fight to get the legislature had to fight to get the department to push out a large portion of the money they were holding back. So eventually, if you leave legislators out, the empire strikes back eventually. But I'm telling you, legislators are in a pickle on this because they're being circumvented. It doesn't go well.
The Empire Strikes Back. Thank you for the Star Wars reference.
You're
That
welcome.
was great.
We're like the Jedi and some of us did Order 66.
Is that what
okay?
I like it? I like it.
All right.
Listen, just a general comment. So we each have different passions and backgrounds up here, and I'll speak for myself. Mine's more in housing and economic development. And so a lot of what you're speaking to today is a foreign language for me. But I am so thrilled that Sylvia and Kendra and Jordan are plugged in with CMH, the right people for the job, and Allison and Joe attending that meeting. And I know Chair Teeples did as well. And you're our guru, okay? And it sounds like you're practically the state of Michigan's guru on this as well. At least you're working with a group of Jedis who are.
That's right.
As you come up with solutions, we're looking to you for direction.
Correct.
So you let us know what you need and what our CMH needs, because at the end of the day, we just want to make sure people get the services that they need to live a healthy and functioning life as much as possible. So thank you for what you're doing, and let us know. We want to be there to help.
Okay,
So
great.
good.
Yeah, I do just want to say I appreciate a lot of what you said, and I agree with a lot of it. I do think it is important to keep in mind that the way that the current CMH system is set up is CMHs are both providers and contract holders with other providers.
Correct.
And that works in one sense, but if we think about this from the provider standpoint, and we already know we're losing providers and providers have a really hard time, with reimbursement rates. In other areas, and I think you've done a really good job of not doing this, but in other areas of the state, we've seen CMHs try and undercut independent providers or assume responsibilities to, instead of privatize, to publicize, I guess, the mental health system. And there might be some advantages and disadvantages to that, but I think it will be interesting at the very least with this RFP process to see, does it create some continuity with reimbursement rates for like a Hope Network?
bet.
Because right now, they get screwed over in one county and they get a
Right.
great deal in another county because we do it so differently. And I think part of that is the fault of the Lakeshore Regional entity.
Correct.
I think part of that is the fault of the way that we've structured it as a state. So I appreciate you acknowledging that there does need to be major changes, because there does. There's obviously some concerns, but you know, to me, I'm at least looking at it in a glass half full mentality. We need to shake up the system, and maybe this isn't the right answer,
Sure.
but I do think there are legitimate concerns from providers, and this might resolve some of them, because yeah, absolutely, this more money needs to go to the patient, but what that means is it goes to the provider. And if we don't have providers, the whole
There
system,
are some providers in our system that haven't got an increase in a decade.
100%.
This is a problem. And I've been addressing it since I've been back at CMH. The fact of the matter is, we do not, besides substance abuse services, we don't have uniform rates in our own region. That's the CEOs getting together with the providers saying, how do we do this? That's what has to happen. And there's been 2 legislative attempts to change the system because this is the issue. Now this, we need to get in a room and view the providers as an extension of ourselves. And that's what we're doing in this county. And it's not popular, but it needs to be done, because a Hope Network or any of those folks, small providers in our county, they could have the same client with the same issues from a different CMH in the state, getting a totally different rate based on no logic model. It's not happening here anymore, but I'll tell you, you are 100% correct. And providers are closing up shop. They're done with, we'll work together. They're closing programs. And then guess who has to do that? CMH has to do it under contract. You know, so I 100% agree with all of your comments.
Very good. Thanks for the report. Very good discussion. Thank you. Mike.
Thanks. So,
Keep in touch.
okay, next time will be shorter, I promise.
Yeah. You had your time. You deserved it, so thank you.
Yeah.
All right. Committee reports. We have no committee reports here. Discussion items. Any discussion items? Seeing none, move on to second public comment. Any public comment? Anybody online? Second chance for public comment. Seeing none. Motion to adjourn. Thank you. We'll be re-adjourned at 10:30 for final.